Hey, welcome to our Freedom from Suffering Now blog. I'm Dr. Steve Grinstead. Today I want to talk about a very important and crucial topic for anyone living or suffering with chronic pain, and that is the role of unrecognized or untreated depression. Of all the coexisting problems, depression is probably the number one that I've seen in my practice for the past 30 years with someone suffering with chronic pain. Other ones are sleep, anxiety, trauma, things like that. But the number one has been depression. And this is really important because not everyone, when you look at them or talk with them, seems like they have depression. It takes an assessment process to really get down and see not only is there depression, but how serious is it? And if it's mild to moderate depression, that is really exciting because at that point, I don't even recommend the person talk to their primary care physician about using an antidepressant, because usually cognitive behavioral interventions will be really enough. What I mean by that is helping people identify and challenge the depression thinking patterns that people get into, and also taking a look at their biological, psychological, social, and spiritual quality of life and see where there's any deficits. Diet, nutrition, and exercise is an important part of chronic pain management, and it's also crucial for depression management. Now, however, if someone has moderate to severe depression, this is where I want to have them see an appropriate provider, usually a psychiatrist or a physician who is very knowledgeable about depression, to see which antidepressant medications might be helpful. And for people with chronic pain, especially nerve pain, neuropathic pain, some of the antidepressants that are out there are really a twofold hit for people. Number one, they help them manage their depression, and number two, they help mediate or manage the pain symptoms. So it's really important that if you or someone you love is living with debilitating chronic pain and thinks there might be a chance of depression, please get help right away. And if you want to learn more about this, if you're watching this video on YouTube, please go to the link below and go to our Freedom from Suffering Now blog. There's also a link for my book, Freedom from Suffering, A Journey of Hope, where I have an entire section on depression identification and management. I really want to encourage people that there is hope, that if you do have depression with chronic pain, it is very treatable. And a lot of the treatment interventions will not only help the depression, but they'll also help the chronic pain. So I want to thank you for joining me, and please check back frequently as we'll be updating my blog posts regularly. So onward and upward. Thank you.